Hello, everyone, and thank you for joining today's Optum Rx webinar, Innovating to Meet Pharmacy's Opportunities in 2024 and Beyond. My name is Heather, and I'll be your host. At the bottom of your webinar screen are multiple application widgets that you can use to customize your viewing experience of the speakers and slides. We also have a widget that you can use at any time to fill out a survey during the presentation to give us feedback. We'll be utilizing a polling tool today with real-time results. We appreciate your participation. For a deeper dive into the topics we will cover today, you can click on the links in the Additional Resources widget. The presenter will only have time to answer a few questions from the chat today, but any remaining questions submitted in the chat will be followed up directly by email from your account manager. Additionally, this presentation uses streaming audio through your computer speakers. To ensure the best possible system performance, please be sure to shut down any VPN connections and connect directly to the internet. If you have any technical difficulty, please click on the Help widget. It has a question mark icon and covers common technical issues. You can expand your slide area by clicking on the Maximize icon on the top right or by dragging the bottom right corner of the slide window. You will receive an email with a link to the recording in the next 24 hours. And with that, I would now like to introduce Zach Morello, VP of Strategy.
Hi, thank you for joining us. We're happy that you're spending the next 45 minutes with us. Today, we'll be covering key forces shaping the pharmacy market and how we're innovating for the future. I'm joined by Sid Sani, SVP of Strategy and Innovation, and Aran Stanesh, VP of Product Development. As many of you are aware, pharmacy continues to be a hot topic in the news. It seems like every day there are new announcements about scientific developments, competitive actions, new regulations or policies, and examples of how consumers are challenged to access even the most basic of drugs. The amount of news can be overwhelming for consumers, payers, and providers of pharmacy care. It's important as we think about the external market to discern true signals from the noise. We need to prioritize limited healthcare resources to offer consumers affordable and simple access to pharmacy care. This requires that we not only solve for the needs of today, but anticipate trends and changes in the market and build a plan to stay ahead of them. So let's start first with the poll. What do you believe will be the biggest driver of innovation in the pharmacy industry over the next 5 years? You can click your choice on the slide, and we'll give the audience about 30 seconds for everyone to respond. All right, just a few more seconds if everybody could select. All right. As you can see, it's pretty mixed across the board. Not surprising with the GLP-1s popping, that new therapies are high, as well as the government regulation. At Optum, we think about 4 key forces shaping the evolution of the pharmacy market. The first is centered around the scientific advancement in therapies and new technologies. It has and will be an exciting period of time for pharmacy, with revolutionary new therapies and innovations coming to market. Let's start with advancements in testing. Pharmacogenomics testing comes at a cost, but has the potential to reduce total cost of care by identifying how the body will respond to medicine before use, preventing costly and adverse drug effects and ineffective drug regimens. The upcoming drug pipeline has a strong focus on personalized medicines and rare disease. Gene therapies have the potential to cure rare and fatal diseases, many of which have no cure today. We're also seeing innovation with chronic conditions. GLP-1s are in the news daily, with numerous weight management therapies, including oral medications and clinical trials. Finally, AI and machine learning present a broader opportunity to use multiple data sets, including pharmacy, medical, lab, demographic, social, mental, and environmental data, to identify opportunities to conduct targeted interventions and reduce cost. The second key force is affordability. Innovation isn't truly innovation unless it's affordable. How can the healthcare system make drugs affordable to payers and accessible to patients that are facing a growing set of financial pressures. For payers, just a few years ago, we talked about drugs costing $1 million. Last year, there was a new gene therapy that already surpassed $3 million. The healthcare system is not yet ready for this type of patient cost, and it will require new solutions and payment models. Additionally, payers are not only seeing growth in specialty medications, but traditional medications as well, due to the utilization of GLP-1s. For consumers, they're also stretched, given high inflation and ever-increasing healthcare costs. Consumers will continue to seek new tools and solutions to compare pharmacy costs on benefit and off benefit to reduce their out-of-pocket spend. We expect to see a proliferation of market solutions and government regulations to continue to address drug affordability. The third key force is the expanding role of pharmacists as a care provider, as pharmacy becomes more embedded into healthcare. Both patients and providers report a high level of trust with pharmacists, and pharmacists are the most accessible and frequently visited members of the healthcare team. As pharmacy automation is expected to more than double by 2030, pharmacists will spend more time on virtual and physical care. This will be critical for health systems, with physicians and nursing shortages continuing. The AAMC expects there to be a shortfall of over 100,000 physicians in the next decade. There are also regulations being considered to expand the role of pharmacists, including administering tests, prescribing certain drugs, and initiating therapies, and greater flexibility in deciding which drug to dispense. A recent Virginia Commonwealth study concluded that if pharmacists had a larger role in prescribing medications to control blood pressure, they could prevent more than 15 million heart attacks and nearly 8 million strokes in the US over the next 30 years. When properly embedded on care teams, pharmacists can prevent medication adverse events, drive medication adherence, discontinue unnecessary medicines, and switch to less expensive medication options. All these actions can improve outcomes and reduce the total cost of care. Additionally, pharmacists are uniquely positioned to champion biosimilar adoption. Pharmacists understand clinical, economic, and operational considerations of biosimilars. They can part with and lead physicians to educate patients on biosimilars. And in pharmacy settings, pharmacists can substitute interchangeable drugs and work with prescribers to substitute other biosimilars. In health system settings, they are positioned to lead how best to optimize and leverage biosimilars in formulary decisions and P&T committees. The fourth key force is the consumerism of pharmacy and healthcare. Consumers will continue to demand that the health system and healthcare become simpler to navigate with more seamless transactions across the ecosystem. They will look for price comparison tools that help them evaluate complex choices on and off benefit, and they will look for a similar shopping experience for healthcare as they have for travel and for retail purchases. Consumers will want flexibility to choose care where and when they want it, whether it's in a brick and mortar location, on their phone, or in their home. I'd now like to turn it over to Sid Sani for more information on new and future solutions.
Thank you, Zach. So Zach covered the external environment that we see shaping the pharmacy landscape over the next 3 to 5 years. What matters, though, is what we and what Optum could be doing about it. So what I'd like to do next is cover what our overall objective is. Before we go there in terms of what we are doing, I'd like to spend a moment on who we are. And as several of you are aware, Optum is on the mission to change healthcare. It is a health services company pushing the boundaries of what healthcare can be. Its 3 elements: Optum Rx, focused on pharmacy care and pharmacy services; Optum Insight, which focuses on analytics, research, and technology; and the comprehensive healthcare delivery system in Optum Health. All 3 of these combined help position us uniquely in being able to meet healthcare's greater challenges. So how do we think we're going to go about doing that? Here is a framework, at least, in which we approach innovation here at Optum Rx. You can see that there's a lot on this page, and I won't cover every single element. But what I wanted you to be aware of is that our approach to innovation is very deliberate, very methodical, and focused on actually creating outcomes. You'll see, I'll run across the top to kind of give you a flavor. First is our focus on consumer affordability. Zach alluded to this in the external environment. The consumer is getting actively engaged and increasingly shopping around. And what we want to do is leverage that engagement, either that be through the digital experience, either that be at the point of care with the provider. There are elements and points at which we can use the engagement of the consumer to improve their experience and actually improve affordability. The second element is around specialty drug costs. It would be silly to have a discussion in pharmacy without actually focusing on solutions related to drug costs in specialty, given the trend that we have seen in them over the last few years. We've got this as a key area within our portfolio and several solutions that will actually dig in deeper as we go through today. The third piece is transforming pharmacy benefit management. This metaphorically and physically sits at the center of how we think about innovation. This is going at the core, at the guts of how pharmacy is priced, how pharmacy is actually practiced in the industry today. We believe, and we're strong proponents of price transparency, of being able to bring cost plus models into the sphere to be able to establish PBMs in their rightful place of actually benefiting consumers and clients. The fourth piece is around the total cost of care. And this ensures that we don't take a myopic view of just looking at pharmacy costs in isolation. Anything that we do in the pharmacy space has downstream impacts, and it is important for us to think about the solutions holistically as we craft the products and ideas we bring to market. And you can see here health equity, behavioral health, key elements that are talk of today in general in society, not just within the pharmacy space, that are integral to how we bring solutions to market. And the fifth and final piece is around emerging frontiers. These are the shiny objects. This is the new stuff. This is the twinkle in the eye. This is the stuff that, while promising at times, can be new. And our responsibility, our take on this, is that we need to be diligent. We need to keep an eye. We need to be aware. But for the sake of our clients, for the sake of the consumers, we need to ensure that we're vetting them appropriately, that we're in fact actually bringing forth solutions that do in fact make a real difference and have the clinical backing needed, as opposed to getting caught up in the hype that may surround some of these solutions from time to time. So you can see a full and holistic view along all of these pieces as we think about innovation and what is going to actually make a difference in the future of not only our organization, but the industry as a whole. What I'd like to do next is actually bring up, well, before we go there, the piece that I wanted to highlight, as I was alluding to earlier, are the integrated offerings. There are elements of this that leverage the entire power of Optum in order to ensure that what we're bringing forward is holistic and complete in its picture. Now, let's go to the polling question that I was alluding to. So the question is, how many unique solutions does Optum Rx currently have in the pipeline that it expects to bring to market over the next 12 to 18 months? I see the number ticking up. I'll wait a few more seconds. Another couple of seconds. Get your answers in. So you can see here the results that you've given Optum Rx credit for. And the winner seems to be 11 to 20 new solutions. The correct answer actually is between 41 and 50. If you look at the overall pipeline of products and the level of innovation that we're focusing on within Optum Rx, it is actually significant and impressive in its size and scale. What are these solutions? And here is but a small sample of these solutions that are already available or are being worked on. As I mentioned, there are about 40 in the pipeline today. And if you look at our overall product availability list, it's actually greater than 200. Now, I don't expect you as a client or even consultants to actually be aware of that entire portfolio. Our role as an organization, our role of account management and our team and our market-facing teams is to actually filter them and bring the ones that are most relevant to you, bring the ones that are actually practical and will solve a challenge you may have, because not all solutions apply to all market segments and certainly don't apply to all clients. But that's our responsibility to filter and bring forward the ones that make the most meaningful difference. You'll see the same 5 elements that I walked across on the previous page at the top of the page here. These are the areas of focus that we have within Optum Rx. But the examples here illustrate real products available today that can solve challenges that we know all of you are facing. We'll actually click into a select number of these as we go forward. But here, let me highlight a few of the ones that we won't necessarily go in depth today. First, you talk about the digital self-service. This is clearly a growing space, and we've seen in our data that digital mobile use is up 15% year over year as we have turned the corner from 2023 to 2024. Something that we're actually very proud of, given how much it is actually helping with self-service. The second thing I want to touch upon is health equity. It is a critical portion of how we think about every single product, whether those be the ones that exist today or the ones that we're going to bring to market over the next 12 to 18 months, and how it affects health equity. First is to ensure that it doesn't increase inequity. But in general, what can we do to drive to a greater level of access and affordability for those that are most challenged in our society? The third piece I'll mention is the one at the bottom in the center, Rx Comment, which is a critical portion of how we innovate inside our organization. We implemented a record number of clients in 1/1 this year, and we did it in record time. And the way we were able to do that was because of automation, because of our ability to ensure that handoffs were minimized, things were taken care of at the source, and it has helped us essentially shut down our command center that we send up earlier than we ever have previously. And maybe the last piece I will touch on is on the top right around biosimilar strategies. We are proud to be the first one to announce a biosimilar strategy. We're proud to actually offer our clients choice in the biosimilar that they can select, specifically, obviously, related to Humira. So these are but a small set of pieces that we are working on that we believe actually will make the biggest difference in the clients that we are looking to serve. With that, let me highlight the ones that we'll actually spend a few minutes double-clicking into, because we think they're the most important, but they're worth understanding at a much more granular level. With that, let me turn it over to my colleague, Oran Stenish.
Awesome. Thanks, Sid. So just moving to the next slide here, wanted to share about Price Edge. So Price Edge is a great product example of how we're getting members the lowest costs that we can. We heard from members and their plan sponsors that they were finding cheaper prices off of the benefit and questioning the value of the benefit. and wanted a way to get credit for available cash pricing. When we looked at the data, we found that the vast majority of the time we were providing best-in-class pricing from the PBM, but on any given day, on any given drug, at any given pharmacy, an individual may find a cheaper price off the benefit. So enter Price Edge. And we've built functionality to compare available cash market pricing to a member's on-benefit cost share and automatically give them the best price. So 3 big things to note. 1, this is all about the lowest net cost for the member and consumer affordability. This eliminates the need for members to shop the cash market because we're doing all of that for them automatically. Second, data. A big problem when folks shop the cash market is losing visibility to the claims. We keep visibility to claims with Price Edge. These apply to clinical programs and safety edits, accumulators and deductibles for members. It's good for members and it's good for our clients. And third, from a financial perspective, you're kept whole. This plays within existing guarantee structures and is offered at no additional cost to clients or members. So we're really excited about this product. We had a great first year in market. It just launched last year in 2023. We now have over 8 million lives on the product and are excited to continue to evolve and enhance this offering as we move forward into the new year. So next, wanted to click a bit into Cost Made Clear. Optum Rx is evolving the PBM industry with continued commitment to transparency, alignment on value, focus on affordability and client and consumer choice. We're bringing forward innovative alternative pricing models that maintain client cost while increasing transparency. Today, with traditional pricing, a PBM pays a retail pharmacy a different price than what's billed to a client. Optum Rx is moving toward innovative new models like Cost Made Clear. Cost Made Clear is a new suite of transparent PBM pricing models that provide additional consumer choice, increased transparency focus. It reduces out-of-pocket costs for members in high deductible plans, optimizes savings across the pharmacy and benefits, and better aligns incentives across the supply chain. So we've got 2 key strategies in place. First, pass-through pricing. This is transparent pass-through drug pricing with lower ingredient costs. It uses AWP and MAC cost baselines and does not guarantee network value to be delivered to the client in real time. Rather, it offers an aggregate level client guarantee annually. Second is cost clarity, and that's our new pass-through model. Pharmacy reimbursement rate is directly passed through to the client billing. The model features cost plus like pricing with lower ingredient costs, and we're using NADAC and WAC cost baselines. This is currently available for commercial clients with 10,000 or more lives. So a ton of focus in this space. You'll continue to see us push into the market with these types of transparent models. So next, going to switch gears here and do another poll. You knew we were going to talk about GLP-1s, so here's your chance to weigh in. How many Google searches are completed each month for GLP-1 drugs? What do you think? 1 million, 2 million, 4 million, or 6 million? Keep the answers coming. A bunch of you are weighing in. I'll give it just a couple more seconds. And let's see. Nice work. It actually is 4 million. So yeah, good guesses, definitely skewing towards the higher end. And that's the gist. A lot of people are searching for GLP-1s. So how did we get here? And the path to the most recent high-cost GLP-1 medications has been a long and interesting one. Over the years, there have been many medications approved for the treatment of obesity with varying levels of efficacy and cost. And prior to GLP-1s coming to the market for the treatment of obesity, there were oral treatments with good efficacy, but they didn't gain as much traction as the newer agents have due to our understanding of obesity as a chronic disease still evolving, really. At the time, what was considered their high cost, and the fact that they were simply branded combination versions of already existing generics. So GLP-1s entered the market in 2010 for the treatment of diabetes, and for the last decade or so have increased in popularity as their efficacy in the control of blood glucose and the promotion of weight loss are really impressive. Drug manufacturers have identified an opportunity to submit for FDA approval for their respective GLP-1 molecules for an indication of obesity. And that started really this tidal wave that we're seeing right now. So Saxenda and Wegovy were approved for treatment of obesity, and Mounjaro's equivalent, Zepbound, was just approved at the end of last year. So as you can see on the slide, the costs are higher on these obesity GLP-1 medications, but they also have really high efficacy. They really work. So this combination of high cost and high efficacy, along with prevalence, so 42% of adult Americans qualify for these drugs per the FDA label, and another 31% are overweight and likely to become obese. So altogether, almost 3/4 of American adults. And then secondly, consumer demand, driven by a lot of celebrity endorsement, including the likes of Oprah, right, have created this unique market event. High cost, high efficacy, prevalence, consumer demand. It's a market event, and we're working to really support the range of client and patient needs in the space. And to start, we've introduced a product we call Weight Engage. We recognize that we need to acknowledge the puzzle pieces that really come together to help manage these GLP-1s effectively. And it's important to note that we recognize we can't, make decisions, or a client can't make decisions on a lifestyle or behavior change program component without first understanding coverage and options. So our work really in this space is in service of expanding affordable and appropriate access with best-in-class clinical and network designs and patient management delivered by both Optum Rx and vetted vendor partners. We are working with pharma to lower the net cost of the drugs. We're working with our clients and thinking about strategic benefit planning, delivering insights from data, delivering flexible client strategies around formulary and rebate. And we have flexible clinical designs and utilization management programs that preserve the integrity of the plan design and ensure the right folks are getting these drugs at the right time. And then we have our behavior change programs. These drugs are proven to be effective when you have ongoing behavior modification, diet, and exercise planning in the mix. So we've got both a lower touch member support program and a higher touch provider guidance program. And we're exploring partnerships with multiple vendors as we move forward. So stay tuned. This is a very dynamic and exciting space. And we're excited to bring forward Weight Engage and to continue to innovate on this solution. So with that, I'll hand it back to Sid.
Orhan, thank you. Let's now switch gears again and talk about specialty, given the importance that that drug class sort of continues to hold in the pharmacy space. And we'll start again with a polling question here. What is the average annual cost of a specialty drug? $40K, $64K, $84K, $104K, or $144K? What do you think? I will say, as people put in their answers here, this is one of those questions before this question came up. It was actually part of what Zach talked about in terms of the overall areas that we are focused on. So I want to see how much is true in terms of what people think compared to what our facts have shown. Now, maybe give it a couple more seconds. Okay. People got it right. I'm impressed. Everybody was paying attention, which is awesome. Or at least 45% certainly did see that. The correct answer is $84,000. And this has gone up significantly, as everybody's aware. They now cost, specialty drugs now cost 13 times the branded non-specialty drugs. So it continues to be a challenge where 2% of the population essentially is driving 50% of the cost in several cases for our clients. So what do we do about it? How do we at Optum Rx think about what this could mean and how we solve it? Here are sort of the 4 high-level pillars in bringing a specialty management solution to market. I'll start from the bottom left. The first is there are proven benefit management tools that are available, things that reduce medication waste, things that make sure that the pharmacy benefit is optimized. There's the blocking and tackling that needs to be done right in order to ensure that the specialty costs are actually being controlled in a manner that is reducing what would be otherwise wasteful spending. The second piece then becomes, how do you layer on top of that care and clinical expertise? How do you make sure that what is being prescribed and taken actually is having the impact, is actually driving to the outcomes, is actually improving the lives of the people that it is intended to do? And that is a critical component of how specialty medications can actually be made effective. Moving over to the right side of the page, there is the need to combine this with the medical benefit. As several of you know, the significant portion of specialty costs lie on the medical benefit. And for us, we need to be able to look across both of them in order to ensure that we're actually thinking about this holistically and not in isolation. Which brings me to the fourth and final point here, which is that the benefit isn't binary. In some cases, you've got the same drug that may exist on this pharmacy and the medical benefit. And it is important that we look at the cross-benefit implications. Where does this drug best fit? How could this, in fact, be best managed in order that we are actually driving to the best clinical outcomes, but at the same time, helping our clients control costs in a manner that is keeping the member front and center. Let me then click into the specific solutions and the suite that we have. You'll see across the top in the blue boxes the 4 areas that I just mentioned. And you can see below them the full set of solutions that can be brought to bear in this reality. And you can see it is a lot. There isn't a silver bullet. There isn't one piece that will ensure that specialty costs get managed effectively right away. But we believe that a collection of these is in fact what is needed in order to drive this. Let me touch upon a few of these to highlight them. And I'll start on the right side of the page where it says Specialty Compass. This is a unique feature that we have here at Optum Rx. And it's unique because it really does and should start with deep and detailed analytics. It is the ability to understand where the specialty drug actually lies, clearly see which benefit it lies on, and how do you ensure that you're actually adjudicating or moving it to the place where it will actually have the best benefit. You can then actually layer on solutions that will tell you, by doing a solution that you see on the portfolio here, what impact it has. How much does it actually move the needle? What impact does it have on member experience? And it enables us to do modeling with you in order to visualize the best solutions and the best set of solutions that will actually make the specialty cost control. So it's a critical piece for us to ensure that we start with deep analytics and a scoring algorithm that can do client level benchmarking. It enables you to see data in a way and make decisions that are informed versus just based on gut. The second piece I'll touch on is in the middle of the page around specialty standards. Specialty standards was a product that we introduced last year, and it has really been successful in helping modernize the specialty pharmacy benefit that exists. It starts and has elements of expert reviews, the highly specialized medications. So, within the 2%, the 10% within that are driving a significant portion of the cost. They're driving up to 50% of the specialty costs themselves. How do we ensure that there is a individualized clinical review that is done to ensure that we've actually taken it into account? There is system edits. We can put in very specific edits around optimizing fills, reducing waste that will actually make a difference. And then the key is specialty ambassadors, which are part of specialty standards to ensure that as these changes need to be made to a person's drug regimen, that we are being proactive. We are actually reaching out to them before they experience a problem to help them navigate the change, to actually help them ensure that we hold their hand as we are able to, in order to ensure that the transition is smooth. So specialty standards really does bring forward elements that are focused on specialty in a manner like nothing else, and we've seen good results. We back this by a 3-to-1 ROI guarantee, and it does help ensure that drug costs on the specialty front are controlled. And then the third and last one I'll mention on this page is actually at the very top left of it, which is Optum Savings IQ. Given the cost of these medications, affordability of them continues to be a challenge. And very often what we have done in the past is be reactive. When somebody expresses an inability to pay to pay the price or to pay their copay, we often then go and say, what else could we do? And what Savings IQ does is actually flip that on its head. And it proactively searches for what financial assistance may be available to that particular individual, and brings that into the mix for the conversation. So an individual doesn't actually need to express any financial stress. They are automatically made aware as part of our specialty pharmacy resources of what may be available for financial assistance. This program in and of itself saved almost $1 billion, $968 million through financial assistance last year. And this was both through foundation-based financial assistance as well as copay card assistance. So it is a significant driver in terms of us being able to provide affordability solutions to the client, which you have hopefully seen throughout the tone of this presentation. I selected a few. I selected 3 of these. We could obviously click into any one of these and spend an hour going through what these programs are, what value they provide to either the client or the member or both, and how it can in fact help in significantly managing the specialty drug costs and the challenges that come with it for our clients. With that now, I'd like to sort of talk about one of the shiny objects, as I alluded to earlier. And this is in the space of pharmacogenomics. Pharmacogenomics is often seen as nascent. It's seen as not fully ready for prime time. And in general, we agree. But what we did was we looked at this in detail and said, is there an element of this that could in fact be a solution? And what we did was, if you look at the drug gene associations, there are more than 300 of those. We went through those and identified 67 of them that actually would be impacted by a pharmacy benefit or by a drug benefit change. And we developed a program that is end-to-end. So if we see someone, excuse me, on those medications, we reach out to them. We make them aware that there could be a better medication if they were to take a genetic test. We then send them the genetic test. They take it, they send it back, we evaluate it, and should there be a change required, we reach out to the doctor. We reach out to the prescribing physician and give them the information that, hey, look, this individual has taken a genetic test and science indicates that they could actually benefit from a drug level change. You can see the results at the bottom. 90% of providers actually were very appreciative of receiving this information. And if we look at the claims data just 120 days out, more than 50% had actually made a change to the drug regimen. So this is helping, leveraging pharmacogenomics to actually make sure that the individual is on the most effective drug based on their genetics. This is the science that will continue to evolve. This is a space that will continue to grow, and we will keep a close eye on it. But it's an example of how we can take science that is emerging and find the right, precise value-add solutions for clients and patients to ensure that we're actually bringing forward solutions that truly, in fact, matter, innovations that will actually make a difference. With that, I will then sort of close this out here in terms of our focus on innovation. You see the 5 areas that we have touched on and we have clicked into. We're very proud of the product suite that is available today. It spans nearly all market segments and nearly all types of clients. Some apply more to others, as I said. And we've got more in the pipeline, over 40 that we will bring forward over the next 12 to 18 months to actually address needs that we see in the marketplace coming up that Zach alluded to when he got us started.